Because this is a message that Congress has to hear and has to hear often. You can be a hero by cutting the research budget this year, and the economic damage that does, doesn't play out in the next election, but it plays out in the decades to come. It's almost a design failing of democracy, that all of the political incentives are near term, and that causes us to systematically underinvest in things with long-term payoffs, like federally funded research. And so making sure that everyone who works in these buildings here understands that those investments pay off not only 20 years from now, but will pay off in the sort of startup operations you're hearing about today.
We believe, Chris and I understand that the value of science in keeping America a competitive place in a global economy is at the forefront. And we want to make sure that we do everything that enhances the chances that science is honored and esteemed. I also would say, perhaps as an aside, that in my view, science gives the opportunity for policymakers like me to have better answers to difficult questions. So not only is this beneficial to our economy, but it's beneficial to our understanding of the world, so that decisions that we make have more value and have greater consequence, better consequence to the citizens we represent.
Thank you, Jerry, for being a good partner in the Competitiveness Caucus, something that we launched because we saw there was not one area to focus on all the different components of competitiveness globally, to look at tax, trade, intellectual property, innovation, immigration, other policy areas that if we don't get them right, we can reasonably predict that the United States will not be as secure and prosperous and promising a country as it's been. And federal investment in R&D is an absolutely linchpin piece of our being a competitive society going forward.
When I joined the university community, I had no idea the depth and breadth of the science that was happening at most universities, covering essentially all topics of inquiry. And what was particularly surprising to me was how commercially relevant so many of these inventions are. And a surprising number of those turn into products that are heading towards the market that will either save or improve people's lives. There were nearly 1,000 new startups created last year based on research emerging from the American universities, according to Autumn. But it's easy to hear those numbers and not necessarily have them have context. Because each one of those companies, if they succeed, will be something that you will all and your children and your children's children will be using in everyday life, and sometimes may actually save their lives.
And I'm Michael Abramoff. I'm founder and president of IDX, an Iowa company. I'm also a physician and a retinal specialist. Many years ago, over 20 years ago, I noticed that many of my people with diabetes, the patients with diabetes, were coming to me with visual loss and blindness. They suffered from visual loss already. And it's something that, if detected early, can be treated very, very well, but you just need to know about it. When I came to Iowa, to the US, I received, at the University of Iowa, I received funding from the National Institutes of Health, from the USDA, it's a rural state, from the VA. And with all this funding, I was able to develop artificial intelligence, AI-based technology to detect this disease early and more efficiently. So right now, IDX is a company that has developed a smart retinal camera, which is a device that's almost robotic, takes pictures of the back of the eye and diagnoses them within minutes, fully automated, so no physician is involved. It's a very good use of AI technology. We started exporting as a company before we ever, started getting revenue here. So right now, it's active in Europe and being used on patients. It's a win-win-win for both the patients, because the people with diabetes get very efficient care, but more importantly, very low care at a very high quality. This product is actually better than me as a retinal specialist in detecting this disease. So that's very exciting. But it's also a win for primary care physicians, which is where the people with diabetes are. they do not want to come to me as a retinal specialist. It takes time and effort and money. They want to be at primary care, and that's where the primary care physicians can manage these patients, these people with diabetes better. And finally, it's a win for people like me, like a retinal specialist, because I don't get to see all these patients who have nothing wrong with them. No, it's only the patients that need treatment that come to me with this device.